Trying to get back on your feet after an orthopedic injury or some kind of surgery, wow, it can feel like such a long, frustrating road. But what if there was a clear roadmap? Something to get you back to your life, maybe even stronger than before? Well, in this explainer, that's exactly what we're going to walk through.
So if you're here, chances are you're dealing with the fallout from an injury or an operation. And that usually comes with a lot of frustration and that nagging question, right? When am I going to feel like myself again?
And let me tell you, you are definitely not alone in this. That constant stiffness in your joints, or the muscle weakness, the pain that makes even simple things like walking upstairs a real chore. Or maybe it's that wobbly feeling, that instability. These are all super common signs that your body needs some targeted help to heal the right way.
Okay, so let's start with the challenge of recovery itself. Because, really understanding where you are right now, that's the very first step to getting to where you want to be.
Here's something a lot of people get wrong. They think recovery is passive, that it's all about just resting and waiting for time to work its magic. But for big things, like a joint replacement, a sports injury like an ACL tear, or a bad fracture, your body needs an active, guided plan to really truly heal.
Well, that active, guided plan, it has a name. It's called orthopedic rehabilitation. And this is your path to healing. It's really the heart of what we're talking about today.
So what is it exactly? Think of orthopedic rehabilitation like a specialized roadmap just for your body. It's this whole field of medicine that's laser-focused on one thing, getting your bones, your joints, and your muscles working together correctly again, all while bringing that pain level way, way down.
And the end goal here? It's so much more than just healing the spot that was hurt. It's about getting back what that injury took from you. We're talking about restoring your strength, getting your full range of motion back, and, this one's huge, regaining your independence.
So a totally natural question is, all right, when does all this get started? After you've had surgery or an injury, do you just wait around for a while? How quickly can you actually get going on this?
And the answer might actually surprise you. A lot of the time, this journey begins almost right away, sometimes just a few days after your surgery. Now, the key here, of course, is that it's always done safely and with your surgeon calling the shots. That early, controlled movement is often absolutely critical for a great outcome.
Okay, so if the process kicks off early, what does it actually feel like? What's involved? Let's get into the how, the specific tools and techniques you'll see on your recovery journey.
Now, this is so important. Your recovery plan is built just for you. It's not one size fits all. It usually starts with very specific exercises to build back your strength and flexibility. Then you might have some hands-on manual therapy to work out that stiffness. There's also gait training, which is basically just relearning how to walk with proper form. Sometimes they'll even use modern tech like electrotherapy to help with pain. And the whole thing wraps up with a plan to help make sure this doesn't happen all over again.
All right, let's talk about the elephant in the room. For a lot of people, the word rehab basically means pain. And that's a totally fair concern, so let's just tackle it head on.
So here's the honest truth. Yeah, you might feel some discomfort as you start moving and challenging those muscles again, but you have to remember why you're doing it. The entire point of the therapy is to get rid of your long-term chronic pain. So a little short-term effort is what leads to that long-term relief.
And, trying to figure out that balance between pushing yourself and overdoing it, that really shows why having a guide on this journey is so important. I mean, you wouldn't try to climb a huge mountain without an expert, right? Where recovery is no different.
See, a specialist makes the whole thing safe and, honestly, way more effective. They build a plan based on your unique goals. They make sure everything they're doing works hand in hand with what your doctor is doing. They give you a safe, step-by-step plan to get back to your life, and they teach you the best ways to keep your joints healthy for the long haul.
So, where does all this work actually get you? What's the final destination at the end of this journey? Well, it's about restoring your movement so you can regain your life.
This quote really nails it. Without a proper rehab process, sure, an injury might heal, but you might never get back to how you were before. Rehabilitation is that vital bridge that takes you from just being healed to being truly, fully recovered.
Because at the end of the day, the real goal is just to get your life back. It's about having the strength to pick up your grandkids again, the mobility to get back to that hobby you love, and the confidence to just go about your day without being afraid of pain. So I want to leave you with a personal thought. Just for a second, forget all the medical terms, and just ask yourself, what is the one movement, big or small, that you would absolutely love to have back? Is it kneeling down in your garden, swinging a golf club,
Or is it just walking down the street without pain? Whatever it is, hold that picture in your mind, because that's the real destination of this journey.